I think it's a few steps to my answer, but let me preface by answering this and admitting that I didn't learn about endocannabinoid system or the science of cannabis for that matter in school, college, university, residency, or even as a young physician. My teachers, who in this case are my patients, actually fueled my passion and dictated my learning curve. But on a more practical basis, I think education about cannabis should begin in primary school when we teach kids about the risks associated with drugs and alcohol, both in school and, in fact, during their driver education courses. And I think we really want them to recognize the dangers of drugged driving, since we have conclusive evidence that acute cannabis intoxication does impair psychomotor skills. And to make an analogy, they say alcohol intoxication tends to cause drivers to commit errors of omission, where they're blowing through red lights or fail to check their rearview mirrors when changing lanes. And cannabis intoxication tends to cause drivers to commit errors of commission, meaning they're taking additional steps to overcompensate for an intoxication, or, they are driving under the speed limit or stopping in green lights. Next, I think we also want probably adolescents to know that cannabis use during brain development really can have adverse effects, particularly among very young people. And I think we need to drum down the science of how cannabis used during these early years. And I know most people think of as the cutoff age around 21 because of alcohol. But if you think about the brain development and synaptic, progression, it's until age, in fact, 25. And there's a lot of data on that. And it can have, if not, I would say, long, at times everlasting impact, since it interferes with the process of synaptic pruning, especially impacting the pyramidal neurons in the prefrontal cortex, which is the seat of our, and especially young people, executive functioning, mood disorders, emotional regulation, and, thinking. Whether it's in the form of lectures, small booklets, or taught in community centers, gyms, or other common places, the fact is that it has to be at the grassroots level by the people who the community trusts, in my belief. They can be healthcare providers, teachers, volunteer workers, even religious or political leaders for that matter. And, later as the students get to the college level and are taking biology and anatomy courses, then I think you can start to teach the basics of the endocannabinoid system. Though I think there are two hows to consider. And, I just want to emphasize those. The first is, how do we teach our students about cannabis-based medicines? And I believe we really need to fixate on the endocannabinoid system as a biophysiological network found in mammals rather than in plants. And once you can show the students how extensive this endocannabinoid system is, once you can show them that it plays a role in everything from digestion to immunology to appetite and mood, you can start to move away from this notion that cannabis-based medicines are somehow alternative. They're not alternative. They interact with specific receptors, and the activation of these specific receptors lead to observable phenomena. So you may be robbing, in some ways, cannabis of its mystique, but I think what you gain is the scientific legitimacy in that way. And the other how is, how do we get the study of endocannabinoid system to be a part of the standard curriculum of medical schools and pre-med programs? And this is a bit more difficult, but I think there are two strategies to accomplish this end. The first is to establish that a healthy endocannabinoid system is integral to overall health because it works with other systems to maintain some degree of homeostasis. Whether it's the CB2 receptor in the immune system or CB1 receptors in the central nervous system or the glutamate release. And the second is to establish that it's an integral component to understanding the dynamics of human physiology and functional anatomy. And that leaving this figurative stone, I should say, unturned is simply a dereliction of duty. I think people within the medical community need to recognize that the endocannabinoid system is more than just something that gets activated when people get high. Virtually every organ is affected directly or indirectly. And it's, I would say, characterized as the body's key mechanism in maintaining physiological hemostasis. So I believe it's a bit like a dimmer switch, because increasing the signaling in the system leads to decrease in other messenger, central nervous system, immune systems, and when the other systems get overloaded, or the neurotransmitters, this endocannabinoid system sort of put on the brakes on those systems like dopaminergic, serotonergic, glutamatergic. So, that's the kind of a sort of a hierarchy in which I think the education can take a role.
Yeah, I think, well, first of all, to say thank you very much for the invitation to have this debate, and an excellent first point of discussion. I think that to really answer this, it's important to early on make a differentiation between adult use cannabis and medical cannabis, of course. And so there are a whole range of issues that come with legalization of adult use cannabis, like we've seen in many states in the United States, whether that's to do with, early education regarding driving, or et cetera, et cetera. That's really, really important, of course. But I think it's clear to make the distinction between medical cannabis early. And so when we're thinking solely about medical cannabis, then it's also important to understand the context of where we are and why we are at this certain stage in education. And so at least here in Europe, with the couple of countries that have legalized medical cannabis have only done so for a few years. And so and that's mirrored in Australia and many other places. And so we've not had any real requirement to provide education to medical students, to doctors, because we've not been able to prescribe these medicines, and so it's deemed unnecessary. And unfortunately, we haven't had the research initiatives and commitments that would have been ideal prefacing legalization, so that we would have not only just the basic preclinical and clinical data in place, but also an educational framework through which we can equip modern day doctors on how to safely prescribe the medicines. And I'll give you, I've been involved in setting up the first medical cannabis clinic in the UK, but I also teach at Imperial College in London. And so I've seen this, I've experienced this problem from a number of prisms. And what I can say is that I think that at the moment in the UK, and I think it's mirrored across many other countries in the world, a lack of medical education is a significant barrier to access for patients. And that is just a consequence of the fact that clinicians don't feel equipped to prescribe these medicines to patients. They are relatively complex medicines in that, at the moment, for many indications, we're looking at 2 active pharmaceutical ingredients, CBD, THC. As we understand more about medical cannabis, this is going to increase. And, as a doctor, I can't think of any other example where I have to, tweak 2 different active pharmaceutical ingredients in a medicine that I prescribe. And in addition to that, for the vast majority of indications, it's unlicensed. It doesn't come in the little book here, like here in the UK, the British National Formulary, that we can with comfort look up doses, contraindications, interactions, etc. And so there's a real apprehension on the part of a large proportion of the medical community, and it's understandable, and it stems in the lack of education. And so now that we have we are able to legally prescribe these medicines, we have really good evidence base pertaining to certain indications. So good, in fact, that it's available on our national healthcare system for free to many patients. But for other indications, less good evidence, and we're building this over time. But whilst now that we're building this, we need to be able to develop a framework through which we can educate doctors. And the question was, where do you start this education? Well, I think that as we have more and more medicines that, in the end reach market authorization and are more widely available, that education will start sooner and sooner. But I think certainly now at medical school, at an undergraduate level, it's something that we have to seriously start considering, because we have to equip the doctors that are, going to be the young prescribers of the future with the skills to safely prescribe these medicines in this, intervening period, whilst we're also building up the evidence base. And so, I've seen this problem manifest itself, and it's actually one of the reasons why we set up Sapphire Medical Clinics, the clinic in the UK, because at this moment in time, when there is such a lack of education, it makes sense to centralize expertise and provide a framework through which we know we can safely prescribe these medicines by a network of doctors who are well educated. But looking at it, like I said, from the other prism in which I work, I've been involved in seeing how we can integrate medical cannabis and teaching the endocannabinoid system into the undergraduate medical curriculum. And of course, in the face of it, when we've had these early discussions with the relevant people in charge of the curriculum, they say this is a fantastic idea. Of course, it's very topical, it's very interesting. But then when you dig down to it, at least, in medical school here in the UK, the system has changed so much. It is so focused on problem-based learning, learning that's not in the same way didactic that I received when I was a medical student, hours and hours of lectures. They just don't do that anymore. And the result of all of that has been that this type of teaching, didactic teaching, is minimal. And when I proposed that we could integrate teaching on medical cannabis at various, at all stages of the undergraduate medical curriculum, they said, yeah, that's great, but we don't have time to teach these medical students what the most common side effects are of the common asthma medications. Never mind something like medical cannabis. We just don't get the space in the curriculum to do that. And so while this is interesting, it's really low down on our priority list when we have these, understandably important things, asthma medications. The other example I was given was, medicines that antacids that, millions and millions of people have prescribed. There's no theory around them in the undergraduate medical curriculum. And so when you put it into that context, it becomes a real problem. And so, of course, that's a problem. What's the solution? Well, what we're working on is maybe seeing if we can incorporate this around teaching of unlicensed medicines, if we can incorporate this as case studies for how drug development has changed over time, and the very unusual case around medical cannabis, in that it hasn't gone down this normal pharma drug development pipeline that we used to. And aspects that have more generalizable applicability in their learnings. But I wholeheartedly agree that we have to do it. It's about coming up with smart strategies to, in many ways, convince the educators and the educationalists that not only is this important, but it will teach the students not just knowledge about specific system, receptors, etc., but maybe a wider skill set that's applicable beyond medical cannabis. And that's a bit of a challenge that we're trying to deal with at the moment.